You know that feeling, right? That frustrating, nagging stomachache that just won't go away. You try everything, cutting out dairy, trying to de-stress, but it's still there, and you can't help but start to worry. Well, let's dive into this because it's a super common problem, but one that's really misunderstood. So what if that nagging pain isn't what you think it is? Doctors spend so much time looking into symptoms just like these. You know what? The answer they find is often pretty surprising. It's usually not an ulcer and it's not some serious disease. So, what in the world could it be? Okay, to get our heads around this, we first need to understand how doctors think about these issues. See, they basically put them into two big buckets. On one side, you've got structural diseases. Think of these as problems you can literally see, like an ulcer, or the inflammation you'd find with Crohn's disease. But on the other side, you have functional disorders. And this is where things get interesting. Here, the structure of your gut is totally fine, but its function, how it all works and talks to itself, is out of whack. And here's the key takeaway. When it comes to chronic pain, these functional causes are way, way more common. So let's put a name to it. What we're officially talking about here is chronic abdominal pain. And the definition is pretty straightforward. It's any discomfort in your abdomen, whether it's all the time or it comes and goes, that sticks around for more than 3 months. That 3-month mark is really what separates, a bad burrito from an actual chronic condition. Right, so when you go to a doctor for this kind of pain, their first job isn't actually to figure out what it is, it's to figure out what it isn't. They start by looking for any red flags, they call them alarm symptoms, to make sure they rule out the more serious structural stuff first. And these are the big ones they look for. It's like a mental checklist, right? They're looking at things like, did the pain start after age 50? Have you lost weight without trying? Is the pain getting progressively worse? Any unexplained iron deficiency, rectal bleeding, or maybe a family history of GI issues like IBD or cancer? It's a really methodical process just to make sure nothing serious gets missed. But here is a point that I think will help a lot of people breathe easier. Even if you do have one of these alarm symptoms, it absolutely does not mean something serious is wrong. In fact, most of the time, even after a person goes through a full, in-depth evaluation, doctors still find no structural cause for the pain. That's a huge deal. Okay, so to see how this all plays out in the real world, let's open up our first case file. Let's talk about Mrs. Williams. She's a 40-year-old woman who's been dealing with a few months of stomach pain, bloating, and constipation. She told her doctor the pain was crampy, and she noticed a really specific pattern. It got worse after she ate, but she'd feel better after having a bowel movement. Now that pattern is a massive clue for a doctor. It turns out Miss Williams did have one of those alarm symptoms, unexplained iron deficiency anemia. So to be safe, her doctors did a full workup, a colonoscopy and an endoscopy. And the result? Both tests came back completely normal. No structural problem to be found. So with all the scarier structural diseases ruled out, her symptoms were a perfect match for the official medical guidelines for irritable bowel syndrome, or IBS. You can see the criteria right here. It's all about that pattern, reoccurring pain that's linked to bowel movements or a change in your stool. See? It's a diagnosis based on a specific set of symptoms, not on something a camera can see. Okay, so if there's no visible problem, what is actually causing all this very real pain? This is where we get into a concept that has totally changed how we think about the gut, the brain-gut axis. For years, we only focused on what we could see, but now we know that the gut has its own complex nervous system. People even call it our second brain, and it's in a constant two-way conversation with the brain in our head. In functional disorders like IBS, it's like there's faulty wiring or static on the line. The nerves in the gut just become hypersensitive. They start sending these exaggerated pain signals to the brain in response to totally normal things, like food just moving through the intestines. So the pain is 100% real, but its source is this complex breakdown in communication. And if any of this is starting to sound familiar to you, listen to this, you are so far from being alone. It's estimated that a whopping 10 to 15% of everyone in North America deals with IBS symptoms. This is an incredibly common condition. All right, let's look at a second case file to see another side of this. Meet Mr. Rodriguez. He's a 50-year-old man who's had pain in his upper stomach after meals for about 2 months. He described his main symptoms as pain after eating, but also feeling full way too quickly, plus a weird metallic taste in his mouth in the morning. Now, you might hear that and immediately think, oh, that's just acid reflux, right? But there are some really key differences here. And this really breaks down that difference perfectly. GERD, which is what we usually call reflux, is mainly about heartburn and that feeling of acid coming back up.
But dyspepsia, which is what Mr. Rodriguez was experiencing, is more centered on that upper abdominal pain, feeling full too soon, what they call early satiety, or just being uncomfortably stuffed after a normal meal.
So Mr. Rodriguez was tested for an H. pylori infection, which is a bacteria that can cause ulcers. And he had it. But even after they treated the infection and it was gone, his symptoms just stuck around. And that is what led to his diagnosis: functional dyspepsia. Just like IBS, it's a functional disorder. That wiring is off, but there's no actual structural damage. Now get this. This chart tells the whole story. Out of all the people who show up to a doctor's office with dyspepsia symptoms, a full 80% of them, 8 out of 10, have functional dyspepsia. Only 20% have a structural cause that you can see. That's incredible. When you say a number like 80%, it really drives home just how common these functional disorders are, which, of course, leads to the most important question of all. If there's no physical thing to fix, what can you actually do about it? Well, this is where the goal shifts from curing something to managing it. The whole idea is to just turn down the volume on those faulty signals running between the brain and the gut. And the foundation for treatment isn't some new medication. It's having a strong, trusting relationship with a doctor who listens and, this is so important, who validates your experience. Just having a professional acknowledge that your pain is real is an absolutely essential first step. Okay, starting from that foundation, treatments can be customized to your specific symptoms. For IBS with constipation, for example, the first step is often simple stuff like soluble fiber or certain laxatives. For IBS with diarrhea, you might use medications like loperamide to slow things down. Now, here's where it gets really interesting. A common treatment is a low dose of a certain kind of antidepressant, and it's so important to understand they are not being used to treat depression. At these very low doses, these medicines have been shown to be incredibly effective at calming down those hypersensitive nerve endings in the gut. They're directly treating the faulty wiring we talked about.
And beyond medicine, lifestyle changes can be absolute game changers. A lot of people find huge relief with a specialized diet called the low FODMAP diet, which cuts back on certain carbs that are tough to digest. Gentle, regular exercise has also been shown to help regulate the gut. And therapies like cognitive behavioral therapy, or CBT, have been incredibly successful. CBT actually helps you retrain your brain's response to the pain signals coming from the gut. It's a way to actively help rewire that brain-gut connection. And that really brings us full circle. For so many people who are suffering with these invisible, frustrating, and very real conditions, the root problem is a miscommunication happening inside the body. So, if that's the case, maybe the most powerful first step toward healing is just having a better conversation with a doctor who truly gets it.